Hello, I'm Dr. Rick Green, a surgeon from Charlotte, North Carolina. It is a pleasure to introduce this wound care program developed by your healthcare team and patients and sponsored by the American College of Surgeons. The wound care program, including videos, booklet, and checklists, will teach you how to care for your wound. Use the skills checklist inside the back cover of the booklet to guide you through the steps in your care. Your feedback is important, so please complete the patient evaluation form by mail or online. I wish you all the best for your recovery. You may have a tube or drain placed in the surgical site to remove excess fluid or blood. This is collected into a dressing, bag, or container. You should see the drainage decreased after you go home, and you may see it change color. You should be shown how to empty the drain before you are discharged, and you should ask if you need to measure the drainage. Open drainage systems like Penrose drains are inserted directly under the suture or staple line into the wound to remove drainage. They may not be sutured in and may have a safety pin at the end to keep the drain from getting pulled into the wound. The end of the drain should be covered by a bandage to collect the drainage. Closed drainage suction systems use a vacuum to draw drainage out of the wound into a container. These drains may be sutured in place to keep the drain from falling out. Negative pressure wound therapy, sometimes called a wound vac, helps to heal a wound by drawing the wound edges together and helps to regrow healthy tissue. A thick absorbent dressing is placed directly over the wound. A tube with a vacuum drain is inserted into the dressing, which draws drainage into a vacuum container. This treatment may be used on many kinds of wounds, including chronic wounds like pressure ulcers, diabetic ulcers, traumatic injuries, or some surgical wounds. A medical supply company will usually deliver the vacuum pump and supplies to your home, and a healthcare professional will change the dressing on a scheduled basis. Before you empty and measure the fluid, you will need to clear the clots from the tubing each time. This is called stripping or milking the tubing. Make sure to wash hands with soap and water if they are soiled, or use a 60% alcohol-based hand gel before touching your wound or drain. Using one hand, firmly hold the tubing near where it comes out of the skin. This will prevent the drain from being pulled out while you are stripping it. Firmly pinch the tubing with your other hand, using your thumb and first or index finger. Squeeze the tubing and slowly slide your fingers down the tubing toward the drain. You may use an alcohol pad or apply lotion around the tubing to make it easier to slide your fingers down the tubing. Squeeze the tubing firmly enough so it becomes flat. Before emptying the drain, make sure your hands are clean and stand next to a sink or use a towel or cloth to protect your skin or clothing. Using a gloved hand, open the cap on the drain. Hold the opening pointed away from you and squeeze all of the drainage into a clear measuring cup or larger measuring container if needed. Record the amount and color of the drainage. Squeeze the empty drain as flat as possible and close the cap. Before changing the dressing, wash hands with soap and water or apply a 60% alcohol-based hand gel. Put on clean gloves. Loosen the tape and remove the old dressing. Be careful not to pull the drain out. Look at the dressing for any unusual or bad-smelling drainage. Put the old dressing and gloves in a plastic bag and throw it away in the trash. Clean your hands again. Check the skin around the drain tubing for any redness, swelling, warmth, or bad-smelling drainage. Clean the skin around your tubing. Open the package and remove a 4x4 size split gauze dressing. Touching only the edges of the gauze pad, place the opening closely around the drain as shown in this video. Layer more bandages to protect the site and the drain from falling out. Tape bandages or wrap a dressing around them to hold in place. Wind any extra tubing in a small circle and tape or pin the excess tubing and the drain to the dressing so it is secure and will not drag or be pulled out. It is very important to try to protect your surgical site from infection. Visitors should wash their hands or use a 60% alcohol-based hand gel. Friends and family should not touch your wound or drain unless they have been trained to do so. Carefully follow your doctor's instructions about wound care after surgery. Clean and inspect the wound and change the dressing at least once a day. Call your doctor if you experience any of these signs: increased drainage or bleeding from the wound, increased swelling or redness around the wound, a foul odor or pus coming from the wound, a fever of 101 degrees or 38.3 degrees centigrade, wound tissue that changes from pink to white, yellow, or black in color, increased size or depth of the wound, pain at the site that will not go away even after taking pain medication, a wound that has split open, or a wound where stitches or staples have come out too soon. If your wound does open, cover it with gauze or a moist, clean towel. Call your healthcare provider immediately for more directions or go to the nearest emergency department.